Good afternoon, everyone. This is Sable Nelson and from NMAC, and we are so excited that you all can join today's webinar, the American Dream Employment Network, Support to Job Seekers Receiving Social Security Benefits. So we're going straight up 3 o'clock, and we're going to get started in just a few moments. There are a lot of people who signed up for today's webinar, so we're going to give them a minute or so to join the conference. So I'm seeing some activity in the chat, and we're going to respond to those questions. In the interim, I do want to launch a quick poll and just see how you all heard about today's webinar. So please answer this question. Thank you, everyone, for participating in our poll. I'm going to go ahead and close that up and get started, and so we can roll into our first presenter, and who has really, really great content for us. It looks like a lot of people were able to get the information via email for today's session. That was the most popular way, and then from there, people were able to get it through social media, our newsletter, or heard about it from a friend. So thank you all so much for joining us. Once again, my name is Sable K. Nelson. I'm a policy analyst here at NMAC, and I'm here with my esteemed colleague, Fernando de la Hoya, so he will be here to help facilitate this wonderful session that we have for you today.
Thank you, Sable.
Just a couple of housekeeping matters. Just want to let everyone know that their audio has been muted by the presenter. If you all have any questions, there will be a question and answer component at the end of today's webinar. So if you all have any questions, please feel free to utilize the chat feature, type any information, any comment that you would like to make, or question that you would like to ask. And from there, you can send it to the entire audience or just to the organizers if that's your preference. And we'll be sure to make sure that we uplift your question at the appropriate time. So with that, I will hand things over to Fernando.
Thank you, Sable. So today we have the pleasure of having the two distinguished presenters from the National Disability Institute. Ms. Marilyn Reward is the co-director of the American Dream Employment Network, a division of the National Disability Institute. Marilyn has more than 34 years of experience developing and operating programs to enhance the life of individuals with disabilities, tapping into 8 years of experience working in the public workforce system and as a nationally recognized subject matter expert on the Ticket to Work program. Marilyn joined the NDI Disability Employment Initiative Technical Assistance Team as the ticket coordinator for 2 years. Prior to working with DEI, Marilyn held leadership positions with the Iowa Public Workforce and State Lead Disability Navigator and the State Workforce Ticket to Work program. For 16 years, she served as the Executive Director of a private disability service provider in Iowa and developed innovative services, programs, and for children and adults with disabilities. She's a graduate from the University of Wisconsin and a certified work incentive practitioner from Cornell University. Our other distinguished presenter is Mr. Kevin Nickerson. Kevin Nickerson is the co-director of the American Dream Employment Network, a division of the National Disability Institute. Kevin is a nationally recognized expert on the effective implementation of employment networks within the public workforce system, as well as within for-profit and non-profit organizations that serve individuals with disabilities. Kevin has over 20 years of experience helping Social Security Administration disability beneficiaries, and he's a certified community work incentive coordinator. He has worked under the Social Security Administration former benefits planning assistance and outreach project, as well as the work incentive planning assistance project. He's a graduate of Cortland State University. Kevin holds a Bachelor of Science degree in psychology. Thank you, Kevin and Marilyn.
And now I'll hand things over to Kevin to begin the presentation. All right, Kevin, are you there?
Okay, now I think you have me unmuted. Thank you, Sable. You can hear me now, right?
Yes, indeed.
Very good. Well, thanks for joining us today, folks, and for that wonderful introduction, Fernando. I thought I'd start out by talking a little bit about some of the fears that both Marilyn and I see in working with people through the Ticket to Work program. And certainly some of these have been fears I've heard over the years, helping beneficiaries understand really what are the incentives that help them get back to work. And we're going to go through those today, but often what we hear is that it's the fear of the benefits being lost. It's certainly the fear of health care coverage being lost. And there is good news, though, and that's what we're going to share with you today. And these are Social Security work incentives, often misunderstood or not understood, or people haven't even heard of these before. So we're going to share not everything today that's going to make you an expert, but enough to help you understand that there are options for you in the return to work. Other fears we've heard is people feel like maybe they're not employable right now. Maybe they've lost some skills or they need some skills updates. All these things can be remedied. We also are going to talk a little bit today about help that we can provide through the Ticket to Work program and how that works. So we are trying to change this culture. We're trying to help people understand that there are options that often people just haven't heard about before. So you're going to hear, hopefully, maybe not for the first time even, but maybe some more clarity around these incentives today. And with that, we can turn the slide, Sable. So what we're going to start off with in today's training is a little bit about Social Security incentives, work incentives. Obviously, that's a big concern. We just laid that out. And if we turn the slide, I'm going to get Sable to help us with a little baseline poll here to try to get a sense of where our audience is at in terms of their knowledge. So Sable, if you can flip that slide, I think the next thing we're doing is the poll. Excellent. Okay, so I'll just, for folks that might not be in front of their computer, I'll read this. What is your current level of knowledge regarding how Social Security work incentives impact your benefits when you return to work? So anything from 0, no knowledge, to 5, advanced. If you could just share that with us, it'll help us just understand where you're at and your level of knowledge around these work incentives. We'll give you just a few seconds, and Sable will show us the results. All right. Well, excellent. Well, we have some folks from no knowledge to some advanced folks on the line. That's fantastic. That means some people have done their homework, and a bigger group right somewhere in between there. So I think what we've created for today is right in line with where we should be. Thank you, Sable, for that. We can go back to the slideshow now. So while Sable's doing that, I just want you to know when we start this presentation, the information I'm going to give you right now is about Social Security disability insurance benefits. For a few slides, I will tell you when I'm going to shift to talking about SSI, but right now we're just talking about SSDI benefits. And for folks that receive these benefits, Social Security does give you something called a trial work period. This trial work period is really lasts for 9 months. It's an opportunity really for you to earn any amount of money with no penalty to your benefit, your cash benefit, to your health insurance. Why is this? Because they want people to try working again with no concern about losing benefits, to see if you're going to be able to do this long term. Now, these months count, folks, anytime that you're working and earning for this year more than $850 in a month. That would be gross. Or if you're self-employed, it would be net earnings, what Social Security calls net earnings from self-employment. And these months do not need to be consecutive, they accumulate. Okay, so you might work next month and then maybe you don't work the month after, and then that wouldn't count as a trial work period month, obviously. And so they accumulate. If you accumulate all of these months within a 60-month period of time, okay, so you've used all 9 within 5 years, then the next part of this incentive package that's available to you begins, and we're going to look at that on the next slide, which we can turn to now, Sable. The next piece of what you need to understand before we move into this is what the substantial gainful activity level is and what this means to Social Security. You see, every month that you're working, Social Security's, if you're on benefits, looking at your earnings. Because when you became eligible for benefits, they looked at a few things, didn't they? Are you insured to get this benefit? Because you don't get this benefit unless you've worked enough and paid into the system enough money to have insured status. They also look at your ability to work. Your ability to work is hinged on this rule they call substantial gainful activity. This year, the dollar amount for that is set at $1,180 per month for beneficiaries who are not legally blind. For those who get benefits because they are legally blind, it's $1,970 a month. So obviously, the third piece of that equation I didn't mention is a disability that qualifies. So there's the disability, there's the insured status, and then there's this other measure that they're always looking at called substantial gainful activity. And even after you're eligible and you're starting to work, this is a piece of the puzzle that they're always looking at. Now, I'm going to mix just a little bit here. For people on SSI, really, after you become eligible for benefits, you don't have to worry about this rule. This really applies to people on disability benefits, disability insurance benefits, and both during application process and after, okay? So we're going to move along now, and I'm going to tell you the next part of this incentive package, which is pretty awesome, because beyond that trial work period, what you get is something called an extended period of eligibility. So not only do you get the 9 months where there is no penalty, I don't care how much you're making, there's no concern. After that, 9th month is used within that 5-year period I talked about. Social Security opens this 3-year period called an extended period of eligibility. So this is yet another safety net, if you will, that lasts for 3 years. This is how it works. For any month that you earn above that substantial gainful activity level within that 3-year period, Social Security may say, we're not going to pay you your benefit for that month, okay? It doesn't mean they're going to terminate you, all right? So months that you're gainfully employed in this 3-year period, it's very possible Social Security may not pay you your benefit. I'm being careful to say may not, because there's additional work incentives that may come into play. Today we're going to try to keep it at the basic level though. So at least you know you have this 3-year period where even if you earn above that level and you don't get paid your benefit, you're not terminated. You're still connected to the program as a beneficiary. And by the way, you're still keeping your Medicare for this whole period, this 3-year period. No questions asked about that. Now, one more bit of good news. Once that trial work period is over, the first time you have earnings that Social Security sees as a pattern of earnings above SGA, the first month in that pattern of earnings above SGA, they will call your cessation month. Okay, not termination, cessation, to cease. That month and the next 2 months after that is another period of time where you get to keep your benefits even though you're over that limit where I said they would stop payment, SGA, right, the SGA level. So the first time they see this pattern of SGA earnings, the first month in that pattern will be your cessation month. The next 2 months after collectively is called your grace period. So you really get 3 more months after the trial work period where you get to keep your benefits, your cash benefits that is, of course your health care, even though you're over that SGA level. So so now you got the 9 months, you got 3 more months, really you got a year you can work at any level and keep your benefits. Now the whole idea behind all of these incentives is that Social Security wants you to see how you're going to do when you get back to work. And of course there's going to be new challenges and there's going to be things that you will face because you maybe haven't worked in a while. This is the opportunity to see how that plays out for you without concern. Now, if we could move to the next slide, what I've done is I've put these concepts into a picture for you, which for me makes sense more than the language I gave you. This is a timeline that really shows you I always think of this like a mall map. You are here, and I don't know where people are at necessarily when they come to us, and we're helping them through the ticket program, but there's ways that we can look at that and figure out what incentives have you used. And from that, we can give you good guidance about what's left. What can you do next? What's available to you in your incentive package? So remember, you got 9 months. That's the trial work period. You can make as much as you want and keep your benefits, keep your health care. Those count when you make $850 or more for this year. That goes up just a little bit each year with the cost of living. After that trial work period is over, then that 3-year period. Now, there's another thing I want you to understand, folks. When that 3-year period starts, it ends 3 years later, whether you're working or not. So I always like to see people use their work incentives effectively, right? I would love to plan with people how to use work incentives rather than do damage control, which often we end up doing because people didn't understand this. So if we get to folks before they've used this, we can be pretty effective in helping you figure out how to use this to see how you're going to do long term. That's the whole purpose of this incentive package. Now remember, you do have that grace period that's going to occur after the trial work period. Generally within that 3-year period, doesn't have to be, but generally it's going to happen within that 3-year period if somebody moves into gainful employment. You see that little green arrow to the right there? That means you're outside of that extended period of eligibility. If you continue to work at gainful levels beyond that extended period of eligibility, it isn't until that point that Social Security may make a decision to terminate benefits. Notice I said termination, not cessation. We know you're okay in the trial work period. The extended period of eligibility, remember, is keeping you tied, your eligibility tied, not necessarily your cash benefit, depending on your earning levels, right? But your eligibility isn't in question in that 3-year period. It isn't until after that that Social Security may terminate benefits. So you have time. That's the point. You have time to figure this out, see how you're going to do long term, and see if this is going to work for you. I'm going to give you even more news because you may be thinking, well, this sounds great, but what happens if it doesn't work out later? We're going to talk about that shortly. Before we move into that, though, Sable, if we could move to the next slide, we've got another poll we wanted to bring to your attention. And just kind of, I gave you some ideas of things I've heard, but, I want to hear from you. What is your biggest fear regarding the return to work? And we've given you some options here to look at. Is it the loss of health care? And you can select more than one. Is it the loss of cash benefits? Is it the lack of skills? Is it that you need training and or education? Or is it something else? And you could feel free if there's something else and you want to share that with us, you could put it in the chat box. But if you don't mind giving us an idea where you're at, what you're thinking, it would be helpful. And I do see some great questions coming in. We'll try to save some time today, folks, just so you know, to address some of these questions at the end of the training. So we'll keep those in the queue. We'll give you just a few more seconds here to go ahead and fill that poll out, and Sable will do her magic and show us the results. I'm guessing somebody checked other.
We have a couple of responses.
Go ahead, Sable. Okay, here are the survey says. 75% of you said loss of health care, and that is not surprising to Mary Lynn and I. 80% said cash benefits. Some said lack of skills, not many actually. Needing training, small percent, 20%, and other 20%. And some of those things I saw in the chat box were concerns about overpayments. Actually, more than one person said concerns about overpayments. Boy, I get that, folks, I really do. And as somebody that's helped literally thousands of beneficiaries understand how to deal with the Social Security system, that's a big deal. We get it. Now, if you do get with somebody that really understands this, that has this certification to understand Social Security work incentives, there'll be a lot more planning happening and a lot less need to be concerned, okay? So thank you, Sable. We can move back to the PowerPoint now. I'm going to tell you about a couple more work incentives for disability insurance beneficiaries before we move along to SSI, where I have just a few thoughts for that too. And I'm guessing we're seeing a little bit of a lag here getting back to our PowerPoint, but we will, folks. There we go. Okay, we can move to the next slide. So another work incentive I wanted to bring to your attention for disability insurance beneficiaries is something called an impairment-related work expense. Sometimes people with disabilities that are getting back to work have more expenses than other folks, and that's just the way it is. But the good news is Social Security can look at this in a way that helps you. If you have some expenses you're paying for that are related to your condition, and certainly would have to be necessary for employment, okay, and there's a third piece very important, paid for out of your own pocket, then we can actually write those off, those expenses. And what does that mean, write those off? You know, when I was talking about how Social Security looks at SGA and whether or not you're gainfully employed, well, they look at what they call countable income. So countable income is actually gross wages minus work incentives, such as an IRWI, and that equals countable wages, or what Social Security looks at when they make those SGA determinations. So this can actually lower the number of dollars that they're looking at when they're making those decisions in your case. Next, there's something that I want to assure you of. 75% of you said you're concerned about healthcare for good reasons. I get it. So Social Security, which is why they give you something called extended Medicare coverage. In fact, this is what I can assure you of. If you do try the return to work and you use your trial work period, you're going to be guaranteed to have a connection to Medicare for at least 93 months beyond the trial work period. 93 months. I'm not a math giant, but I think that's like 8.5 years or close to it, something like that. So that's a long time to figure out healthcare coverage, isn't it? It's not like the rug gets pulled out from under you and you are wondering what to do next. You have time, and we will help you think through some things. In fact, I'm going to give you some more information about healthcare that I think will reassure you. But it does provide lots of time to explore. Employer-sponsored healthcare obviously would be awesome. That's what we would love to see people have and move on to. Okay. Also, some states have Medicaid buy-in programs. This is a way to get to Medicaid in a very different way than has ever been available before. Okay, we can move along. So one last thing, very important for disability beneficiaries, if we move to that next slide, Sable, is one last incentive I want you to be aware of. And this is the question sometimes we'll get. What if I work successfully? I go back to work successfully, and I'm terminated from my benefits, right? I'm way beyond that extended period of eligibility. There we go. And then you have to stop working because of your condition. So now you've used the incentives, you're doing great, they terminated you from benefits, and you lost your job because of your condition. Now you're like, wow, why did I do this? What was I thinking, right? Well, good news. There is something that didn't exist prior to the Ticket to Work legislation, and it's called an expedited reinstatement of benefits. This is only for former beneficiaries. So beneficiaries who have been terminated because they worked, because you did take that leap of faith, because you did try to move forward. And then what happens is you lost the job because you're conditioned again. Well, I'll tell you what, we've got 5 more years from the point at which you're terminated. Now, that's way beyond the trial work and extended period of eligibility, potentially, right? So when you're terminated, it opens another 5-year window for us to use this expedited reinstatement of benefits if need be, because you had to stop working because you're conditioned again. As long as it's related to your original condition and you've not gotten better, and in most cases people have gotten worse, right? You could be eligible for benefits. Really, this is kind of a backdoor to Social Security. One more important thing I want you to know about this. While they're making a decision as to whether you're still disabled under their rules, if you use this incentive, you get paid provisional benefits while they're deciding if you're going to get benefits again for up to 6 months. That is the period it takes for them to make a decision. So this should be really reassuring, I think, to people who want to try working and then could see that there's a potential for me to fail. Then what? Well, this is what we would use. Okay, Sable, we can move along. Now I'm going to talk about incentives really briefly that apply to SSI, that's Supplemental Security Income. Okay, so we're not talking about disability now, very different benefit. SSI works very, very differently, and the rules are all different, and they're very much mathematically driven. But Social Security has great incentives for people that receive this benefit as well. You know, this narrative here that I have out, or these exclusions, they're good and they're true, but they don't work as well as showing you the math. But basically, what I want to bring your point out here is the 1/2 earnings exclusion. That's kind of a big deal. That means that for every $2 you earn, they only reduce your SSI by $1. So when you're on SSI and you want to work, you can work. You will get a reduced SSI benefit, but the more you work, the better off you're going to be at the end of the month because of your reduced SSI benefit plus your earnings. Now, there's many incentives. I'm not going to be able to get through all these today, but I wanted to just show you that that's kind of the biggie, that 1/2 exclusion. There's some others that we're going to talk about, but I'm going to show you in a formula. Sable, we can move along to the next slide where I'm going to talk to you about something called the federal benefit rate. Now, people that get disability get it based on their work history and the amount that they paid in, so they're going to all have very different amounts in benefits each month. People that get SSI get a benefit based on something called the federal benefit rate. This is kind of important to understand because this is a needs-based program also based on disability. So what we have to understand with any program like that is what could you get, what did you do, work activities, what we'll talk about, and based on that, what are we going to give you now because you have less need. That's kind of how all these programs work. But the maximum benefit rate for somebody who's single for 2018 is $750 a month. That's not a lot of money. And if you're living on SSI, you know. I'm not telling you anything you don't know. If you're a married couple, it's $1,125. So in most states, the state will offer a state supplement, they call it. And you know, I'm not going to talk about that because it varies state by state. Some states don't even have that. Most do. Okay, if you did want to know really how to find out what that was in your state, you'd have to talk to your local field office. But you probably know because you're seeing it go into your bank account if this is a benefit you get. Okay, Sable, we can move along. I'm going to give you an example here. This is a mathematical example that shows you what happens when you're on SSI. There we go. And to the right, we have some parameters here. This is an example where we're going to use the federal benefit rate of $750. So that's for somebody who's single that lives alone. That's what that rate applies to. Also in this example, we're going to say this person is making $1,120 a month. I want to show you the impact on SSI in this example and what happens when the person works so that we can show you if you're better off or not. What I love about SSI is it's a mathematically driven program. Therefore, it's all about the numbers, and the numbers don't lie. And it's pretty easy to see. If you see on the left column here, folks, it says without work, what you're seeing really is what the Social Security claims rep is doing behind the scenes. Of course, they're doing it with a computer. It's all automated these days, but this is their formula. This is how it works. So if you're not working, obviously you're going to get the full SSI rate of $750. If you do work, what happens? Well, you can see that the math applies. There's a general exclusion every month that can be provided. There's an earned income exclusion of $65 they can exclude from your income. But more importantly is that 1/2 earnings exclusion you can see there. So instead of 1120 counting against you, you can see the total countable income line there on the right with work. 51750 is all that counts against this person. So if we take that away from their SSI at the bottom there, you can see that their SSI is reduced to 232.50. But if I add that to the earnings, look at the bottom line. The bottom line, even with that reduced SSI, with the person working, is over $1,300. So there you go. Are you better off working or not? You decide. There's the numbers. That's how it works. Sable, we can move along. One other important thing I want to tell you about SSI is, Medicaid comes with SSI. Medicare comes with disability. You identified, as we thought you would, that healthcare is important, and we get that. That's why I wanted to bring to your attention something that protects your Medicaid. Even if you earn so much money that based on that formula I just showed you, you would be eligible for nothing at SSI, or what they call the break-even point. So if you make enough money to exceed what they call the break-even point, where you're not even eligible for $1 of SSI anymore, you do not lose your Medicaid. And it's because of this provision that's called 1619B. It's a provision in the law. And this allows you to keep your Medicaid and your connection, by the way, to the SSI program, okay, as long as you still meet these criteria that I have listed here. So you still have you still have a need for this insurance, and you can't afford to pay for everything out of pocket, which nobody could, right? You wouldn't have earnings sufficient to replace what Medicaid could cover. Most people wouldn't. And it's all based on a threshold. Each state has a different threshold. I'm calling you from New York today. I looked up ours this year. It's over $43,000 that you could earn, be out of pay for SSI, and still be connected to this program. So, I kind of kid with people sometimes and say, I hope you lose your Medicaid, because the thresholds are so generous that people would be better off making the amount of money it would take to get them off SSI, because they'd be above the threshold. And at that level of income, my assumption would be they'd be getting employer-sponsored health care. So I'm not mean. I say that sometimes just to get people thinking. And boy, it's great. This provision right here is something you should hang on to and know that this protects your insurance, okay? Sable, we can move along. One last thing about insurance, and then I'm going to turn to my partner here. But I'm going to tell you just a little bit more. I mentioned it briefly, Medicaid buy-in. This came out of the Ticket to Work and what they call the Ticket to Work and Work Incentive Improvement Act. Out of that, of course, came the Ticket to Work and Self-Sufficiency Program we're going to talk about, but also came the option of expanded Medicaid for people with disabilities, by the way. This is very much a state work incentive. If you have a disability and you're working, then you can, if it's available in your state, not every state has this, most do, then you can connect to Medicaid at much higher income guidelines. Again, here, I can only give you an example here from New York. We'd have to look it up for you, or you could go to somebody in your state and ask about this. But it was over $55,000 that a single person can make and still be tied to this. So even if you got terminated from SSI because you were over that 1619B threshold, you, if it's available in your state, could then connect to MBI, Medicaid buy-in program, whatever they call it in your state, at an even higher income guideline. So there are ways to deal with insurance. I guess that's the message today, folks. Again, not to make you experts on this, but to just highlight some of the good news that really is hidden, I feel, behind all these policies. So I hope that helped to make a few of these points more clear. And with that, I'm going to turn to Mary Lynn to talk to us more about the Ticket to Work program.
Well, thank you, Kevin. And if we want to advance to the next slide, that'd be great, Sable. Thank you. The Ticket to Work program is another component of Social Security's effort to really encourage people who are on benefits to consider going to work. So we're going to have a polling question right now. Okay, so our polling question is, are you using your Ticket to Work with an employment network or state vocational rehabilitation agency? And your options would be to answer yes, no, perhaps you're not sure, or you do not receive disability benefits. And we wanted to kind of find out if how many of you on the call, may be aware of the Ticket to Work program by having this question. And we also are hoping to provide you with maybe more information if you are using your ticket, or if not, that you may have one and you might want to take advantage of it. So there we go. Let's see what we have. Okay, so looks like the majority of you are not receiving disability benefits, and even those of you who are, you're not using your ticket. So let's talk a little bit about Ticket to Work. And if you would advance to the next slide there, thank you. The Ticket to Work is part of a legislation that was passed in 1999 called the Ticket to Work and Work Incentives Improvement Act. And there were 3 key components of that act, and we're going to just talk about the one today, which is Ticket to Work and Self-Sufficiency Program. The whole goal of that particular component of this legislation was to decrease ticket holders' dependency on their cash benefits. And how would they do that? Well, it's because they are increasing their earnings to a substantial level of employment. And ultimately, maybe even considering getting off of benefits so you're not dependent at all on these benefits. Social Security recognized that individuals who receive these disability benefits have thought that maybe you're going to need to have some support to help you get back into the workforce. So they created service providers that gives you the choice of pick who would you want to help you with your employment goals. You had 2 choices, employment networks, which we call an EN, or state vocational rehabilitation agency. You might be asking, well, who is a ticket holder? And that's related to the question we asked you. If you are receiving SSI or Social Security disability insurance, and you're over age 18, but under 65, you have a ticket. You may not even be aware that you have a ticket. You may have never heard of the program, but if you are receiving benefits and you're in that age range, then you have a ticket to work. The next slide is you may have just some general questions about how it works. So do you have to use your ticket? No, it's a voluntary program. You do not have to participate, and there is no cost to participate. As a ticket holder, who decides where am I going to use my ticket? Well, you decide. This is your plan. This is your employment future, and you decide who do you want to support you along this path to get back into employment. So you are the ones who are making the decision of assigning your ticket to an agency who you feel can best provide the services you need. You can also unassign your ticket at any time. So you're in full control of this. This is your ball game. And so you have the full control of this decision making. Now, if you are a ticket holder and you're wondering, well, what happens after I get a job? Can I continue to get support after employment? And yes, you can. This is a long-term employment program. Even if you receive services from your state vocational rehabilitation agency, you can continue to use your ticket with an employment network, so you have ongoing long-term employment support. Long-term meaning up to maybe 5, 6, 7 years after you're on the job. Now, some of you on the call, if you do get benefits, you're gonna realize that periodically Social Security is going to check to see if you still meet their definition of disability. That's called a continuing disability review. And if you are using your ticket to work and you're making progress, and that's kind of another whole subject of what does Social Security call making progress, and we don't have time today to go into that, but the bottom line here is if your name comes to the top of the list for you to have your review and Social Security sees that you're using your ticket to work, they will be suspending that full-fledged review. They may ask you a few questions, but it's not going to be the entire review. So for some people, that's really a relief. It kind of helps you, that's a stressful situation, so it helps you defer that situation until further down the road. And the last question we often hear is, if I use my ticket, does assigning it or using it affect my current benefits or my health insurance? No, it does not affect it, all right? This is just a way to support you to get back into employment. And the next slide kind of shows you a visual chart. It's an arrow that shows the progression of what happens during this ticket program. So it basically starts out, you identify if you have a ticket. You then choose who do you want to support you in your path to employment. You make a choice by using your ticket. you don't literally get a ticket. It's not like there's a magical item that's mailed to you. You will get a letter saying you're in the program, but you decide if you want to then follow through and choose an employment network or a vocational rehabilitation. Whichever you choose, you're going to sit down with them and you're going to develop an individual work plan or an employment plan. This is a roadmap of what are your goals for employment 1 year from now, 3 years from now, and what are the steps to get there. And then services, you're going to sign that plan, and once it's signed, your ticket is then started. It's assigned. And then you are going to begin getting those services to lead you to employment. And once you get a job, then Social Security is going to, you got to report your wages, right? That's something you have to do. So Social Security is going to be aware that you're working, but you've got to tell them. And you got to tell them if you ever stop working or get a wage increase or reduction or increase in hours, you got to keep them informed. And what Social Security does is if you work at a certain level of earnings, then Social Security will actually pay that agency, that provider that helped you. So that's kind of the process of how the program works. Now you might be wondering, well, who are these employment networks? Well, I'm going to talk to you about one of them, and that's the next slide here, the American Dream Employment Network. I'd like to introduce you to this employment network. It's an employment network that Kevin and I oversee. So we're very closely related to this because it's the program we work for. It's a very different employment network. And the next slide tells you, well, who are we? Well, the American Dream Employment Network, we're a national employment network, delivering these services and employment opportunities to individuals who have a ticket across the country. And we have a network of providers and professionals who help you with seeking your employment, once you get employment, assisting you along the way. And the American Dream Employment Network is a division of National Disability Institute. And I think what you will find interesting about our mission is to provide a better economic future for Americans with disabilities. In other words, we are hoping that perhaps through the path of employment, you could have a brighter future, have a little bit more security, financial security. So why would you choose AIDEN? We always tell people when you're in the market to find an employment network, shop around, ask questions. So here are some points on this next slide of why maybe you would choose the American Dream Employment Network over some other employment networks. Well, we not only want you to get a job, we want you to have a career, and we are hoping that you can have a higher quality of life with a greater degree of financial security. We designed the American Dream Employment Network with success in mind, so you could have an opportunity to better your life. And we have this group of professionals across the country. I'm going to show you a map in just a second. And the other thing that's different besides the fact we're national and we have this experience, but we provide services that are beyond what is required by the Social Security Administration. And I'm going to list those services on the next slide. Actually, why don't we just go to that right now? We have 5 core services that we provide to anyone who assigns their ticket with the American Dream Employment Network. Career counseling is the first one. That's helping you determine, if you do not know, what kind of a career do you want to pursue? What's a good match with your educational background, your employment background, your skills and natural talents? And helping you get into employment that's going to have some longevity, that promotes a well-being for you, so you don't have to, get into a dead-end job. The second service we provide is job search supports. And that's a variety of different types of supports that helps you with that search until you can land a job. So it might be looking at needing some workshops that you might need to refresh some skills, crafting a quality resume, giving you tips on interviewing, filling out job applications, some tips on building a network of support to help you get into a particular company, or looking at particular job banks that target hiring people with disabilities. The third core service is Social Security Work Incentive Advisement. So on this next slide, Kevin already talked to you about the fact that there are these work incentives. And Social Security, you know, we all realize they're kind of complicated. So it's best that you select an employment network that has knowledge about these benefits and the available work incentives. So you get the certified personnel counseling you and advising you on that subject so you can make a good decision. The fourth service we provide here, which again is unique, is for the ticket program, is we connect you with professional financial services by personnel who are experts in this field of money management, establishing good credit, financial education, repairing credit, creating a budget, all those pieces that are related to your financial matters with your own personal information. So again, you can not only have employment, but you can take that employment and manage what new income you have so you can have a better future. And the last service that we provide is number 5. It's called long-term ongoing employment support on the job. Once you get a job, we don't go away. Now, you can certainly, you know, tell us to go away. That's your choice. But if you want to keep working with us, we're going to be there. We're going to be supporting you, contacting you once a month, seeing how you're doing, identifying if there's any concerns or barriers for you to keep your job. But maybe you want to move up the career ladder, or maybe you found that there's a job posting that you'd like to apply for that's closer to home, or better benefits, or better pay, better hours, and you want to apply for that. We can help you with that. We're not only helping you with stabilizing on the job and adjusting to those changes on the job, but we're looking at, you know, other factors that, again, if you want to move forward in your career, we're there to support you. Currently, AIDED, American Dream Employment Network, has 57 members. We're in 23 states. There's a map here that shows we're primarily located more so on the eastern half of the United States, but we continue to add every month new states. And we're growing, and if we're not in one of your states, we can still help you, because there's a possibility we can provide you with a virtual service some way that you can get that through technology, using computer, email, telephone, etc. So the next steps, we want you to think about a few questions. Have you thought about your employment goals and what type of work you would like? Have you thought, would you be able to manage part-time, full-time work? It's always good to put down what is your work history, what's your educational background, because those types of information can help a provider like us, kind of guide you or advise you what might be the direction you want to go. If you're on these Social Security benefits, have you worked with state vocational rehabilitation? And do you have plans or interest to maybe get off those benefits? So if you think you want to discuss going back to work and you're on Social Security disability or you're on SSI, please call us at our toll-free number, 844-687-2336. You can certainly visit our website for more information. It's americandreamen.org. So I believe our next slide is, again, our contact information. And I'm going to turn it back over to Fernando or Sable and see if there's some questions or how they want to handle questions.
Awesome. Thank you so much, Mary Lynn and Kevin. That was an incredible presentation. We got a lot of really good feedback in the chat box, and now we're going to open up the floor to some questions. We have recorded the ones, or we've saved the ones that have been in the chat box up to this point, but if you'd like to ask your question in real time, please raise your hand, and what I'll do is I'll unmute your line so that we can hear your question asked. But in the meantime, while people are thinking, Fernando, did you want to read one of the questions from the chat box?
Yes, please. Thomas would like to know, how is the recipient to plan their household budget with such complex and variable roles?
Well, this is Kevin. I can tackle that one. I think what they're saying, the person's asking is, if I don't know what's going to happen to benefits, how do I know how to plan my budget? This is why we've built into our structure that service, which is the benefits, what we call benefits and work incentive advisement services. So you see, if you can predict when there's going to be changes to your benefits, you can have a budget. In fact, we also have ways to connect our participants, that's what we call our ticket holders, to financial services that can help in budgeting. So when you combine the advice that we've given you, because we've got certified work incentive practitioners here, along with the skills of somebody that can manage a budget with you, then I think you have your answer.
Okay.
Thank you. We have a question from the same participant. Thomas would like to, it's saying, it's more like a comment that we would like your opinion about that. Employers are unwilling to consider older job candidates. They have become pros at skirting non-discrimination laws.
Okay, I'm going to. Yep, I'll go ahead and try to comment on that. You know, historically, we all know that there has been certainly some hesitation in maybe hiring people with disabilities, and maybe even individuals who are older, you know, mature. I guess I'd rather call us mature workers. But you know, you have to really look at what skills can you bring to the table, and what are you able to really bring to a company. And I think that's a focus that we strive to look at. How do you basically sell yourself, and the, you know, the contributions that you can make to the workforce. We do know there's been a shift in our country in regards to hiring people with disabilities. There's a lot of HR, human resource departments who have, I recognize that disability is an asset. Having somebody with a disability is an asset to their company and can bring, you know, some really strength to the problem solving and creativity to a workforce. There's also employers who are what they call a federal contractor, and they have an obligation to, you know, not discriminate and to have affirmative action plans. So those efforts to, you know, do help. So I'm not saying it's not an issue out there, but I do think we're making some progress, and you really have to have the support to identify what can you bring to that company.
Thank you so much, Mary Lynn. And it looks like we have somebody who's raised their hand as well. So Frank, I'm going to unmute your line in just a second. Make sure that you've also unmuted yourself. And I'm going to also, as we're beginning to wrap up, thank you all for participating. Continue to send your questions via the chat feature, but I'm also going to launch a poll while Frank is asking his question. Frank, are you there? Frank, it looks like you're self-muted. All right, while we're...
Okay,
Frank?
okay, I can hear you now. Can you hear me?
Yes, we can. What's your question?
Okay. Well, first of all, I would like to thank the presenters. I mean, there was a lot of good information here, and especially because recently here in San Antonio, our Ryan White program received a HRSA grant called a SPINS grant. We're only like one of 8 cities, and this is kind of one of the focus on getting people back to work. So some of this information is helpful. But my question is that I've been on SSDI since 2009, and I'm 61. And I think, a lot of people, especially like in our closed HIV long-term survivors group, there's, a lot of people kind of have a distrust right now, especially with the current political administration of like Social Security. And, people are saying they've been getting medical reviews when they haven't had one in years. And things of that nature. So I guess it's reassuring to hear from you guys who have this experience that if you want to use the ticket to work, it's not going to automatically like strike up a medical review, because that's what I hear a lot of here from other consumers. That if they inquire again about the ticket to work, that it could possibly set up that review.
Frank, this is Kevin. I'll comment on that, and Mary Lynn can too if she has any thoughts. But I think what's going to happen is when you go to work, right, you're going to generate income. When you generate income, Social Security will send out something called a work activity report. That's standard practice. That's them collecting the information they need to see what work incentives have you used. Okay. As far as the actual medical reviews, Mary Lynn highlighted that one of the protections of the ticket program is that Social Security can't conduct those, what they call continuing disability medical reviews, if you're making progress in the ticket program, and for good reason. If you join the ticket program, you're committed to moving forward to a level of self-sufficiency and less of a reliance on benefits, right? So really what they're saying is let's leave these folks alone that have joined the ticket program as long as they're making progress in the program, because they're setting up their own path off benefits instead of us worrying about a medical review. So I'm going to say I don't see that randomly happening, Frank. In our experience, I can tell you, if anything, what I know is that they're way behind on those reviews and years behind. So I don't see them really. I haven't really seen any ramp up. I just think that occasionally if somebody is in a cycle for that review and it's late, they will eventually get to it.
Okay. Well, in that regard, I'm sorry.
Go ahead.
No. But one of the local case managers here, and I think I did read this. Also, I guess, in, I believe, March of last year, Social Security, they did, I don't know, they did kind of state that, I guess previously, if you were on SSDI for HIV or HIV related condition, you kind of had a more or less kind of a protection, for as far as having the regular standard medical reviews. But I guess they kind of changed the wording on that last year, where, people, that's why I guess people who have never had a medical review and been on SSDI for years are now, in the past year, they've been getting medical reviews. So that could be, one of the answers there.
Mm-hmm.
Yeah,
Frank,
and I was just going to point out, go ahead, Kevin.
Go ahead, Mary Lynn.
Well, I just want to point out, and I put it in the chat, by using your ticket to work, but when you assign your ticket and that gets, we notify Social Security you've assigned your ticket like to us, that does not trigger a review.
Okay, that's good.
So it's when you start being employed and you're reporting the wages and so forth, that Kevin explained how that works. But by just the fact you're using your ticket, that does not trigger that to happen.
Okay. Well, great. I know there's some other questions coming in, so I don't want to hog the floor here, but thank you very much.
And thank you for your question, Frank. Yes, another question came in through the chat box. It asked if AIDN work incentive coordinators are trained about HIV-specific benefits like ADAP and HAQA that need to be included in an assessment of issues and opportunities related to work.
Well, what I can say to that is that AIDN representatives are trained by Cornell University's work incentive practitioner process. And, there's always, I could just say this, folks, there's always policies changing. And it's hard to stay up on all of them, but we try to. And certainly our certification process helps us to bring everybody to that basic level of understanding of these incentives. So I don't know if that directly answers the question, but I think that any changes in policy are brought up as a part of people getting certified.
Wonderful. Thank you, Kevin. And we also have another individual who had some questions about a specific issue as it related to their concerns about having a review triggered after utilizing their ticket. We certainly would encourage you all to utilize AIDN services so that you all can have your individual and specific issues clarified at that time on a one-on-one level. But we're just trying to go through and see if there are any more. I'm not seeing any more hands raised, and we're just going to go through the chat one more time. It looks like there was a question about transportation. Fernando, did you want to read that?
Yes, Brian would like to know if there's any assistance for transportation to go to work. And transportation, it keeps coming up as one of the main obstacles for our constituents, even to access medical care.
Well, transportation is certainly an obstacle kind of all over our country. And, you know, depending again on your individual case, there might be a way a work incentive could be applied if you have to have an expense of using transportation due to the fact you're unable to transport yourself because of your disability. So there perhaps could be a way of looking at a work incentive. But AIDEN itself, if you're just looking for an EN that provides you the transportation, we do not provide that. Very, very few ENs do. But again, we would certainly look at the work incentives and look at what's in your community for a possible resource.
Wonderful. Well, we're at exactly an hour. We would definitely want to honor everyone's time. Thanks so much to our presenters, Kevin Nickerson and Mary Lynn Ravar. It's been really, really great to hear from you all, and it seems like there's a great service that you all are providing as well. We also want to thank everyone who participated in today's webinar. I just wanted to remind you that it has been recorded, and you will be able to access it via one of the channels from NMAC. And also, we want to make sure that we can hear from you. There is an evaluation at the end of the, as soon as you exit the program. So we would love to hear from you in terms of what you thought about this webinar and things that you would like to hear from us going forward. So once again, thank you so much for participating, and I hope that you all have a great rest of your day.
Enjoy your weekend.
Thank you.